Right now, we're experiencing the largest surge in COVID-19 cases in the U.S. that the U.S. has ever seen. Coronavirus hospitalizations are higher than any other time of the pandemic. According to the COVID Tracking Project, 17 states have reported single-day highs. Doctors say the U.S. is entering the worst period of the pandemic since the early outbreak. Deaths are also rising to the highest since late August, pushing the 7-day average up to more than 1,000 people dying every day. Joining me to discuss this is Bloomberg's John Lauerman. John, first, can you tell us a little bit more about what's causing these numbers to rise so quickly?
Well, I think there are a number of forces at work right now. We have an epidemic that's growing, as everyone predicted it would, in the cooler winter weather. People are going inside. There's a good chance that the virus can live longer on certain surfaces, lives longer in the air. And I suppose there are other things you could say are at work as well. Fatigue, dealing with issues like mask wearing and that sort of thing. So when you've got a lot of virus floating around, and of course we do have lots and lots of people who are infected right now. The virus is in many more places than it was earlier. So there are many more opportunities to get infected.
Now we're seeing deaths remain relatively low while hospitalizations are higher than ever. Is that change related to an improvement in treatments perhaps, or even testing?
No question that treatment is getting better and the testing is more widespread. But as you just mentioned, we are still seeing about 1,000 people die every day from the coronavirus. And as you know, deaths are a lagging indicator. You're seeing hospitalizations rise right now. I think as long as you see hospitalizations rise, you're quite likely to see deaths rise a few weeks later when all those hospitalized people, or a certain percentage of them, start to succumb.
Okay. Now, right now, a winter surge in cases seems inevitable, but is it possible to stop it? Well,
that's the question. That's the question that we keep asking of society and over and over again. And of our whole healthcare system. The way that communities right now can control the virus is through adhering to the many measures that states and the federal government have implemented and suggested. Those include things like avoiding crowds, wearing masks. Dr. Fauci talks about these measures all the time. We've seen that increases in cases are often associated with gatherings, for example, in restaurants, in bars, places like that. So to the extent that people continue to congregate, we'll continue to see infections rise. To the extent that they, avoid using masks, we'll see infections rise, I would think. Can that be headed off? I think it depends on what people do.
Now, John, thinking about vaccinations, Pfizer recently announced that their vaccine is about 90% effective. Can you tell us a little bit more about how scientists are able to draw these kinds of conclusions, both for treatments and for vaccines?
Yeah, these are really interesting, fascinating studies of these new vaccines that developed just over the past 10 months, and it's amazing to see what's happened. So these vaccine studies look in populations of about anywhere from, say, 20,000 to 50,000 people. Actually, there's one study, the Johnson & Johnson study, that has 60,000 people in it. And generally the approach is, you recruit all these thousands of people into the trial, and you vaccinate half of them. They walk out the door, and then you see who gets infected and who becomes symptomatic. You don't really need that many infections to tell whether or not the vaccine works. You just need to know whether the vaccinated people get the disease, or whether the unvaccinated people get the disease and the vaccinated people don't. And if it turns out that way, if you have many more cases in the unvaccinated population than the vaccinated population, then you can tell actually relatively quickly whether or not the vaccine is working. The Pfizer study has been going for about 4 months now. I think about only 2 months have elapsed since everybody in the study was vaccinated twice, because these vaccines, this is one of several vaccines where you need 2 doses for the vaccine to actually be effective. And then after you get the 2 doses, I think about 3 weeks to a month has to elapse before the full effectiveness takes place.
Okay,
so,
Bloomberg's John Lauerman, thank you so much. So sorry we're out of time, but we appreciate the information.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.